by honorable members so that they can respond to those issues before I call the Attorney General to finalize and wind up. Thank you. I am being reminded by my technical team to advise the honorable ministers to be very brief. Thank you.
Yeah. Thank you very much. Distinguished Honorable Speaker and distinguished honorable members, we say good evening to you all and thank you very much for the elaborate debate. We are honored to stand here today to give you our opinion as to what is transpiring. This shows that COVID-19 is not an easy task. It is unprecedented. We've never seen it before. It's something that our generation has not seen. Even the developed countries, most of them had never seen this phenomenon. Certainly for Gambia, it's also new. It has an impact on the lives of people, on the social fabric, on humanity, on finances, on the way we live, on the way we interact. So this is how complex the issue of COVID-19 is. Madam Speaker, the pandemic of COVID-19 that's going around the world, we believe in the Gambia, we should thank the Almighty Allah for giving us this period that we consider as a grace period, and we want to continue to pray that it continues like this forever. But I think this period should not be wasted. This period should not be missed. Whatever we do, we need to act very fast, very decisively, to take the decisions that tomorrow we started making comments of what should have been done and were not done. And I hope tomorrow we shouldn't remember today as not having done what we should have done. We've had 4 cases, positive cases so far. 1 person died. 2 of the others recovered. We thank the Almighty Allah for that. And 1 is currently undergoing treatment and is stable at the government treatment center at the sanitarium. By way of statistics, we now have 88 people in quarantine, 162 completed quarantine, 310 individuals completed follow-up, 233 contacts were traced, total number of tests conducted 128, 4 of them were positive, 123 were negative, and 1 inconclusive test that will have to be repeated soon. Madam Speaker, distinguished honorable members, since the inception of COVID-19, a lot has been done. Since the pandemic, since the outbreak in China, and up to the declaration of the pandemic, and we thank all of you for your support. We thank all of you for going into the communities to sensitize the people, because to us, that is phenomenal in the sense that when we speak to colleagues in other countries, they have never done that. So that means even the way we responded to COVID-19 here is unique by the inclusion of the National Assembly members, and we commend you all. Because we keep on saying to them, each National Assembly member represents a constituency. And when you put all the constituencies together, you have the Gambia. So that is a strategy that works, and other people are started even thinking of learning that from the Gambia. So a lot has been done. We equally thank the National Assembly Select Committee for Health for all the hard work. It's not been easy, but they've been with us throughout, coordinating the things, the chairman and the other members. You can see the chairman is very apt, and he knows the details of what we do, and is able to say them as and when we do them. We thank them as well. We want to use the opportunity to apologize for the logistic delays before you went. Unfortunately, these are unprecedented times that we want to get things done within a short period of time. But equally speaking, the procurement rules must also be followed. I think that delayed us, and somewhere along the line, unfortunately, certain things we detected that I'm going to elaborate on towards the end of my intervention that also delayed it further. That warranted the delays, but for the inadequacies, we didn't know your number of villages. We wish we had been provided with that, and that would have determined how many of the items you would have gotten. I'll go straight to comment on some of the comments and questions. The member for Tumana did ask, how many testing and isolation centers do we have in the country? Currently, we have one testing center, and that is at the MRC Gambia. Now, people had been commenting, how come it is the MRC that is doing testing? The MRC is a well-renowned and well-established research center. Even in developed countries, quite a lot of their tests, quite a lot of those kinds of activities are done in research centers, because that is their work, that is what they do. They have improved on the systems, they have perfected the system, or close to perfection. Even in the West, the universities, the hospitals, big hospitals, partner with research institutions. Research institutions do a lot of work for governments, and governments, in fact, sometimes give research institutions grants to develop items, to do some tests for them, and so on. So I think that is in line. Without the MRC doing it, they would have been done in Le Pasteur Institute in Senegal, which is a reference, a regional reference lab. And still, some samples are sent there for quality control. Because when we do tests here, then we send a third or fifth test to Le Pasteur Institute for quality control, to ascertain that the tests that are being done here are up to standard. And this is a normal thing, and it is for our region. Now, we were told that that institute itself is not really for the Senegalese government itself, and we have similar arrangements. However, the ministry has started to do assessment for our Kotu Central Lab, and that assessment team, including some specialists from the MRC and other people, have started doing the assessments so that we are able to get them ready to do the test in our center. And even across the country, we've identified 2-3 other centers so that people do not have to come all the way from our country, or the samples do not have to be carried all the way down to be able to test them. So we're working on that. There are 10 isolation centers. Some of them are okay. Some others are going to undergo renovation very soon. The assessments have been done, and we are working on that. The treatment centers are 2 for now. The Medical Research Council can take only 2. They have only 2 rooms for treatment. At the sanatorium here, which is the main treatment center, we are able to take 42. It has 42 beds for treatment. Now, is that going to be enough? We pray that it is more than enough, but we are not folding our arms and sitting down. We are working on having more treatment centers across the length and breadth of the country. Now, the World Bank, as part of their projects that we are going to talk about, are going to build a brand new state-of-the-art infectious disease treatment center for us in the Gambia within this short period. and they've started working on that. Now, the other treatment centers we're going to build, for the time being, they are going to be temporary structures. Temporary structures and parallelly more permanent structures. The temporary structures, because if we've seen it happening elsewhere in the world, because if there is an exponential growth, exponential number of cases in the country, we have to be able to house them somewhere. So we are in collaboration with partners, the government, the Ministry of Health and Finance, are working together with the partners to put up some temporary, about 6 of them, across the length and breadth of the country. Various ideas came up initially. One of them was to use the existing structures and then dedicate areas of those facilities for COVID-19 treatment. But of course, evidence also came that sometimes in the developed countries, some of the other patients got COVID-19 because the centers are shared. And some of the staff who were not even involved in the management of COVID-19 also developed the disease. For that reason, we said that was not the way to go. Now, suggestions also came. Why don't we take some facilities in some parts of the country and dedicate them as COVID-19 hospitals? But we said again, what happens to people with other ailments that are not COVID-19 who are in those villages or towns? Where do they go to? So we say that's also not a solution, and we agreed now to have temporary shelters as the permanent shelters are being constructed. The member for Tumana also mentioned that the funds should not be diverted into individual pockets. I guess the issue of the 500 million, let me discuss that last, because so many people spoke about it. So it will be very comprehensive. So I'll skip that so that they all come together. Now, with regards to the duration of when do we have the state of emergency, I'm sure my colleague, the Honorable Minister for Justice, will discuss a lot more about it. But I think what we also need to know is the epidemiology of the COVID-19 as to what is known for now. Because as we speak, there are still quite a lot of things, probably even a lot, that is not known about this disease and this virus. Because as time goes on, a lot of new things come into play and they determine what is done next. So the responses keep on changing, and here and there you hear escalations, and we need to escalate as we learn more and more things, and we need to put on strategies that help us to deal with the situation as it evolves. So if we have had cases, and the issue of those cases that came, we have had 4 positive cases for now. And the other issue of why didn't we close the borders and then allow those cases to come in. COVID-19 is different from Ebola. Their modes of transmission are not the same, mainly. And Ebola was found in some 2 countries, mainly 3 in West Africa, confined there. So those countries, their neighbors, were secluded. Now, it's different from COVID-19 that is found worldwide, and the mode of transmission, even the distance, becomes very important if we interact. And now people are even talking more of asymptomatic patients infecting people, other people. They don't have symptoms, but they infect other people. Now, then the same question could have gone. Why didn't everybody not shield China off? Then probably the disease would have stayed in China. It wouldn't have gone out if China was blocked completely throughout the world. But how feasible was that in this modern day and age? And the other argument was, now, if you seal the country off, we are not even sure at that particular point in time whether people had left China and were elsewhere. And that's the other argument people put forward. The time that even travel was banned in China, most people had left. But Gambia, we had the same situation. Because as we speak now, and we've all heard, people were agitating for a lockdown. We've had that for many weeks now. And now the situation is, because if things get bad, we pray they don't, probably people then at that time will ask us, why didn't the government and the National Assembly think of a lockdown today? If things get bad, that's probably what they'll put to us. Why didn't we think of a lockdown today? If we had lockdown, then the disease wouldn't have spread. But now the balancing effect comes into play. We have to balance the consequences of the impact of the disease. If you ask me alone as health minister, I would say lockdown today. Because I believe a disease that's communicable and passes from one person to the other, if we have a barrier between the infected and the non-infected, most probably we'll control the disease. So as health minister, I would say lockdown. But now, we also have to be considerate of the other areas. We talk about the resources. Do we have the resources to spread across? And these were the considerations really, to be fair to government, these were the considerations that went behind the scenes. Do we have the resources? Can we feed everybody? If we say lockdown today, if we cross the borders, Gambia doesn't manufacture any of these items we use in our hospitals. If we cross the borders at that time, are we going to get imports? How are we going to get the items to take care of the other patients who are not COVID-19 patients? Most of what we use in Gambia is unique in the sense that we don't manufacture most of these things. Even Senegal manufactures a lot of things. The IV fluid we give the patient, Senegal manufactures them. Sometimes the syringes and the needles, they manufacture a whole lot of things. We do not. So when we are in such a situation as ours, a poor country like ours, closing the borders too fast has challenges. Of course, medically, that's what I would have recommended. But the other people also said, what about this, what about that? Now, when we had people coming from Europe, now we couldn't say to other countries, you cannot evacuate your citizens, because we were advised that's against the international law when they want to evacuate their citizens, when they think their citizens are under threat. Now, those people were coming to evacuate their citizens, and our Gambians were stranded at the airports of those countries. Some of those Gambians, they don't have money anymore, they have nowhere to stay because they were supposed to come home. Now, that was a difficult dilemma, whether to allow them, instead of those flights, aircraft to come empty and evacuate the foreign citizens from here back home, and now people are stranded at the airport. These were the difficult decisions Gambia, the government, had to take. And certainly we thought we took the right decision by saying our people stranded at the airport should be brought in as well. Now, but I must say here, I'm happy that all of you thanked the health team for the efforts, because I think the people, they did very well. COVID-19 diseases that people are running away from. These people chase them, follow them into their homes, go to them, talk to them, sit with them, take samples from them. And those are the fluids, the body fluids that we don't want to be in touch with. But these people go and take those samples. Their lives are at risk. In fact, some of our people now, when they even go to interact with other people, they know that they are the people who went to take samples yesterday for that positive case. The people try to even stigmatize them. In fact, I was giving some statement the last time, and I coughed myself, and it was on live TV, and later on the journalists were telling me, you need to do the test yourself. Because even as health minister, because I interact with them, I go to the places where the people are quarantined, and I go to the health facilities, they say so. So this is how difficult it is for our people. And believe me, I'm happy that you thank them and the message will get to them. Because some of them, as we speak, there's no Saturday, Sunday. I myself go to bed every day, 1 a.m., 2 a.m. consistently. But some of these people, they don't even go home now. Those are the treatment centers. Their families don't see them because they don't want to go treatment center home. So they are living away from their families as we speak. This is the sacrifice that they are doing for nation. Now, this is like when there is war and the army is at the forefront trying to protect the country. This is what the health workers are doing, and I'm happy that you recognize that. The idea of longer duration of scaling down and reduction of the movements, it is to allow for containment. Because we have seen, for many countries, when they have seen the first few cases, there is a lull. Thereafter, they get an explosion. So we are thinking, as a country, when we have a lull, when the thing seems to be stable, let's take the aggressive measures. Some think we have a few, so I think this is the opportunity Allah has given us, that you have a few. Do all what you can do so that the few does not multiply. Because if it multiplies, then we say, well, we wish we had done it when we had only 4 for so many days, only 4 for so many days. I think we need to act very fast.
Sorry for the interruption, but time is not very much on our side. And I'm sure honorable members would love to hear from the Honorable Minister of Finance.
I'll make it fast. So, thank you.
For health, I think we know all the health issues already. So if you can just wind up and summarize.
Okay, that's fine.
Thank you. Thank you.
Yes, thank you very much. And well, I will now probably lump them together. I was jotting down the comments that are related to us from each honorable member. Now, with regards to our committee, thank you very much. Someone mentioned, one honorable member mentioned, we actually have a cabinet committee that meets almost on a daily basis, that looks at it at that level and is chaired by the Vice President. So it brings on board all the most of the ministers, that are relevant, defense, all the others that we think are relevant. So there is a very active cabinet committee that meets to discuss this every time. Now, we talk about the financial aspects. When the COVID-19 issues came, I must say Gambia, we tried because we started very, very fast compared to most of our neighbors in West Africa. We came up and we constituted a National Health Emergency Committee that has people from the Ministry of Health, from the Army, from the police, from the National Disaster Management Agency, from Red Cross, from WHO, from UN, and so many other partners. And including our veteran health workers who have retired from international work, who some of them are epidemiologists, some of them had taken part in controlling Ebola in Democratic Republic of Congo. So we have a wealth of expertise within that committee, and we've all been working together. Now, the committee has 6 subcommittees: coordination, case management, psychosocial therapy, surveillance, and so many other activities. Now, this committee was tasked to develop the COVID-19 plan. So this plan was developed and it was costed. Now, so there is actually a costed plan. This costed plan, it was about $8.8 million US. Now, then there was no promise of any funding. This was put forward to the partners. to government and various partners. And some of the partners were in the meeting, actually. The partners, World Bank took it upon themselves. And fortunately, at that time, we had the World Bank senior health expert in country helping us, he's still here, helping us develop our new funding cycle activities. So he happened to be here, he took it on board and then spoke to them. And he told us probably they can get some emergency funding for this COVID-19 fund, for these COVID-19 activities. And they've been working hard on that. But this has components related to each of these activities: coordination, surveillance, case management. And the case management, so the procurement of equipment and so on and so forth. Now, the activities, that costed plan will be shared with you at some point, but the activities that we are looking at as a ministry in our response program, the sensitization. So those funds are supposed to be spent on sensitization. Posters, billboards, communication materials, even using the local communicators.
I must apologize again, Honorable Minister, for interrupting you.
But they wanted to know the funds, and this is very important.
Yeah,
Because
but
this has been a big bone of contention. No, that one, the minister would not be able to say those details,
no,
probably.
Okay.
But you see, because
with,
they talk about
with the committee.
But I think this is very crucial if I may. I appeal.
You can provide the committee with that. The committee can call or you make a written statement.
But this is on TV and they need to hear it. I appeal. Okay. 5 minutes. Okay. Yeah.
Thank you. Let's compromise.
Okay.
5 minutes.
Thank you, ma'am.
Thank you.
And follow-up of these patients, of these individuals, now the frontliners need to be paid allowances. You see, health workers, especially when they are risking their lives, no one can ever pay them enough, but they need to be paid allowances, the frontliners. Even though that allowance system, some people attempted at abusing it, unfortunately, and that's not acceptable. Now, other things that renovation of these facilities, but most importantly, the procurement of equipment, because we have had a very weak health system. We all know it. Most of our facilities don't have the equipment. So this is an opportunity as we respond to the COVID-19 to put in the facilities what we need. So the ventilators, the X-ray machines that we do not have in Bansang and in Soma, or Bansang has one old one, or Soma and Basse, all those are going to be equipped from this. Ambulances, there are 33 ambulances that are going to be procured for this COVID-19, and when it is over, inshallah, it will be for the country. A host of things are on this. Now, protective equipment for the health workers are also part of this. The test kits. And part of, now, so this is the World Bank funds. It is all costed and you will see it. But we should also know that for COVID-19, this is one of the most dynamic situations we have ever seen in the world. The plans keep on changing based on what is happening, based on the reality on the ground. So we should also bear that in mind. Now, when it comes to, this was what the World Bank was to do, and they have not released any money yet. In fact, the plan, the minister is going to talk to you, it was signed. Now, about the 500 million, in fact, when that was announced, we said, the program has started. Of course, some eyes opened, some mouths opened. They thought that money was going to be like that. But I assure you, honorable members, and I assure the people of this country, I think at the Ministry of Health is a different thing altogether now. When the head is correct, the place will be correct, and I think the head is correct. One of these things that we've been seeing, when the 500, so for the information of the honorable members and the general public, the 500 million is not handed over to the Ministry of Health. That's not the system. In fact, as we speak, it is with Ministry of Finance. Nothing has been disbursed of that. What has happened now is, before the 500 million issue came up, we made a request of 6 million. Ministry of Finance gave 4 million. Now, then later they gave another 8 million, making it 12 million. It was the 12 million that was being used to buy some of these things, these sanitizers and these items. But because it came in our normal budgetary allocation, it has to go through the same processes. And that slowed down the processes. And the minister will tell you, even out of that 12 million, is only 11 million that has been spent so far. So the 500 million they are talking about, an account is opened called the Special Projects Account, where it's going to be transferred into. Yes, certain activities, certain things that need to be procured for the smooth running of these activities, some are ongoing, and the minister is going to elaborate that will start taking part of that 500 million. But so it is not even given to Ministry of Health. We have not seen it physically yet, but it is there and nothing has been spent so far. So I think this is important. Now the other one, finally, I will say, recently there's something going on. There's some social media thing on, and people are concerned on the allowances. Yes, we know we have people amongst us. They will not change and they will not give up trying. They'll keep on trying, but will they succeed? That's the issue. So if people try and their trial leaks, I don't think there's cause for alarm. Because what we did with this thing, when I went to see the Minister of Finance, I said, this thing, first we need expeditious and judicious use of these funds. But because it's emergency, procurements need to be done fast. But under those circumstances, people can abuse them. I suggested the formation of a committee, and he said to me, I'll support you. And we have a committee. The committee is the Permanent Secretary, Ministry of Health, and few senior members, Permanent Secretary, Ministry of Finance, few senior members from there, the Accountant General, the Director of Internal Audit, the Director General of GPPA. They sit over every procurement issue so that they can decide and make so there is transparency and accountability at that high level. And they report to us and we see what they have decided on. So this is how this, every request goes through them. The disbursements, all these things go through them. Now, I said to a group of people, I said to the people who are responsible, who are making the list for these allowances, I said to them, I, the Minister of Health, I don't want any allowance, I don't want any honorarium, I don't want any butut. I'm doing sacrifice for my country, irrespective of the time.
Thank you.
Now, a few days down the line...
I think that's a convenient point. Yes. That's a good point to start. Yes, I think so.
A few days down
the line... I think that's a very
A few days down the line...
Yes, Honorable, yes, you see, we need to stop at 12 o'clock, before 12, 5 to 12.
1 minute, I'll just...
Latest, yeah.
Few days down the line, they put forward a long list. A long list of many names. Now that list did not get to me for vetting. It went straight to this committee. And this committee detected that it was bogus, and I was alerted, and we withdrew it, and I told them to withdraw it, and we reprimanded them for that. So this is what is happening, and we are observing all the processes. The committee was set up by us for accountability and transparency from the high level, so that everything Ministry of Health is doing, Ministry of Finance knows, the Accountant General knows, the Director of Internal Audit knows. And these are strong measures that we have to do.
Thank you.
Thank you very much.
Thank you.